So today we're going to talk about dry needling. We get a lot of questions about what is dry needling, how does it work, and stuff like that. So we want to do a little bit of a educational series on what dry needling is and how we integrate it into our plan of care here at Trifecta Therapeutics. So what is dry needling? Dry needling is essentially using a thin monofilament needle, an acupuncture needle, although we're not practicing acupuncture, in order to treat dysfunctional muscle tissue or trigger points. The goal of this is to provide pain relief, but also address other dysfunctions such as perhaps flexibility or mobility deficits as well. This is part, as I said, a part of a multimodal approach. Usually using dry needling alone may not be as effective as using dry needling as a component of an exercise and manual therapy program that's being performed. So to perform dry needling, the area has been cleaned. I'm going to take a 40 millimeter needle here, and this would be a patient example of if you were to treat low back pain. So what I would do is I would map out exactly where I wanted to go. So in this case with Kate, I'm going to aim for the lower lumbar erectors. So as I'm going to palpate the spinous process, I'm going to move like 1 to 2 finger breaths out laterally. And palpate the muscle tissue. I could always have the patient, extend her head to actually feel the muscle tissue contract. I'm going to use a light bracketing technique. There's a guide tube with the needle. I'm just going to do a little tap, and the needle is inserted. So now I can direct the needle into the muscle tissue where appropriate. And I can also optionally add electrical stimulation to this in order to speak the language of the nervous system and further enhance that neurophysiologic effect.